Hi, I'm Dr. Jack Sharratt. I'm the clinic director here at Sharratt Chiropractic. Thank you for joining us today. I want to talk to you about TMJ syndrome, also known as temporal mandibular joint syndrome. It's named for that reason because of the anatomy involved in the problem. Specifically, the mandible or the jawbone articulates with the temporal bone in our skull. This joint is used in mastication or eating. It's also used in speaking, and in my case for singing at least twice a week. The TMJ the temporal mandibular joint really isn't a true joint. It's actually a sling. Our jaw is held to our skull by 5 muscles of mastication. Some on the outside of our jaw and some on the inside of our mouth. There's a small ligament connecting the mandible to the temporal joint, but largely, if you were to sever these muscles, our lower jaw would literally fall off of our face. The proper movement of our jaw when we talk or when we eat is like a sling. It actually, when it opens, our jaw drops down slightly and then it arcs forward like this. When a person has TMJ syndrome, it's typically marked physically by an offset in that rhythm or in that normal biomechanics. So instead of their jaw dropping down and arcing forward, it does this. One side will be premature relative to the other. So there'll be an unevenness. And even the patient can tell, you know, my jaw's not opening and closing evenly. Well, what are some of the symptoms associated with TMJ? Classic is headache. The other is very tight and sore jaw pain. It might be even blurred vision, ringing in the ears, but it's often characterized by point and painful tenderness of the temporalis muscles and the masseter muscles in the jaw on the outside, and a headache is really classic. Well, how do we deal with this common problem? And it is common because more and more in our busy, chaotic, upside-down world that we live in, more and more people are clenching and they don't even realize it. They're clenching their jaws, they're tightening this up, and they're throwing off the balance of the TMJ so that it's doing this instead of this. Our approach to handling this is threefold. First of all, we make sure that nerve interference is absent from C1 and C2. The muscles of mastication are controlled by nerves coming from the upper part of the cervical spine or the neck. We make sure that those nerves are not encumbered by misalignments or biomechanical interference from the spine. So chiropractic adjustments are pretty basic and approach to handling. In addition, we will release and balance the muscles of mastication, and there's 5 on each side. We will do this through either manual stimulation or possibly ultrasound from the outside of their body. In addition, I'm a big fan of wearing a night guard, and this one can be molded by your dentist, or we have one here in the office, actually a photocopy of one that's sold commercially for a very affordable price. You don't need to suffer with jaw pain and headaches with TMJ. See your chiropractor. For more information about temporal mandibular joint syndrome, visit us at www.sharrattchiropractic.com. Thanks for joining me.